Catalina, you are going to be up next. Did you want me to share?
Yes, please.
All right, let me pull that up for you. And I'm going
And
to.
I realized when I was looking at the slides last night that it's slightly out of order, but I'll try to try to make it sensible.
You tell me backwards, forwards. I'll be happy to do whatever you
Okay,
wish.
no, we'll just go through. So I chose this subject because it's something that I worry about a lot. I work, in maternal child, I work lactation department, sometimes labor and delivery. And one of the issues is if we have a mother who has cholestasis, then often the baby has to be delivered early. And babies who are delivered early don't feed as well and have a lot of other problems. So I have been sort of mulling about this for a while. So if you could go to the next slide, please. So some of the signs and symptoms are that, things start actually a lot earlier, but itching is the thing that presents when she comes for her prenatal care. She'll say, oh, my hands and my feet are itching. Later, you might see kind of yellowing of the skin, or the whites of the eyes are kind of yellow. So it has that jaundicey appearance. Sometimes they talk about loss of appetite or nausea. Next slide, please. So why homeopathy? Because there is absolutely no treatment for this from the allopathic perspective. And just to back up a little bit, chole means bile, or gall. And what happens is, for a variety of reasons nobody really understands that well, the bile from the liver is blocked. So the bile that helps digest the food isn't able to do that. The fats aren't digested well. The bile that is not moving kind of spills over into the blood, and then you have these bile acids from the blood that's circulating. And of course, when the woman is pregnant, the blood is circulating between the mother and the baby. So this is hard on the mom, but also hard on the baby. What they'll tell you is, avoid processed food and sugar, full fat dairy, soy products, processed meat. But do cool baths or over-the-counter medications, topical. But there's not, they just have to now. And once it gets to this stage, you have to really watch it, and it's super uncomfortable because she's tired, and then she lies down to go to bed, and then first her hands and feet, and then later sometimes the whole body is itching a lot. If you could go to the next slide, please. So, the allopathic solution is to wait till about 37 weeks pregnancy and induce the labor, and, try to get the baby out. If you don't do something, that you have a couple of risks. And the most serious one is, of course, that the baby is stressed and then dies in utero. So, and then, you want to move it. You want to move it forward if you can on some level. You can track it, and you can see if whatever treatment you're doing is getting things better. And you do try to wait until about 37 weeks. So I think from an homeopathic perspective, we have a time and an opportunity to use some of the homeopathic meds that are gentle remedies, that are gentle and supportive. Next slide, please. So this is the one that was out of order. But anyway, so one of the ideas is that the pregnancy hormones, both estrogen and progesterone, originally it was thought was just estrogen, as they rise, the closer you get to your due date, that may be slowing down the flow of bile and the digestive fluid in the liver that helps your digestive system break down fats. Instead of leaving the liver, the bile builds up in the liver, and as a result, the bile salts enter into the bloodstream, and that's kind of why you feel itchy, among other things. Next slide, please. So I looked and looked and looked at a bunch of different remedies, and two came up very strongly: anacardium and sulfur. And some of the symptoms are, the itching, dark urine, pale poop. So fatigue, loss of appetite, pain in the upper right quadrant. It's interesting that there are a couple of groups where it's more common. It's very common in Scandinavian, in Indian from India, Pakistani, and Chilean. Talk about pretty diverse groups. So of course, we know as homeopaths that we can't just give random remedies, right? We have to do a much more in-depth look. And I looked at, for some reason, late one night, Crotalus horridus came up, and maybe avghi, you can say why, because when I went back to look at it last night, I was like, oh, I don't know why I saw this, but I know I saw it from a couple of the symptoms. So I leave you with more questions than answers, but I do think, and I've been talking with a friendly obstetrician who is interested in trying some of these with some of the patients, so that we can see if we can, because if it works, they'll feel better. And if they feel better, and the blood tests are better, we can delay the induction of the labor, and that would be beneficial to everyone. Thank you.
Thank you, Catalina. That was really, really great. So fantastic. And I love, that maybe this OB would be interested in that. And I know here today, some of our students are in the medical field, some are nurses, some are medical doctors. It's like really great to bridge that gap, So yes. Does anyone have any questions for Catalina?
Yes, I do. So how early can that start in a pregnancy? How early do you see it, and how fast do you have to react in order?
Oh, but you don't see it that early. It's usually the final trimester. But once it starts, it moves, for most people, it tends to move along pretty quickly. And so, and it's miserable. So, you want to address it if you can.
And there are no telltale signs prior that when you work with pregnant moms, you can say, well, let's get the blood test done or anything like that.
Oh, no. We do blood tests and check the acid levels in the blood. And, I think it's 10 micrograms, I forget, but anyway, it gets to a certain level, and then, you have to move on it. But that's the only thing. There's nothing. Did I answer that question?
Yeah, you did. Thank you.
Yeah, but usually it's the symptoms, and principally the itching. Once they tell you the itching has started, then you're starting to really watch. The other things develop later usually.
Okay.
I had a question about the babies. Do they end up with jaundice after birth, that they have to go under the lights or anything?
So yes and no. This is the thing with jaundice. It's actually probably 80% of babies have some sort of light jaundice, and that's kind of for a different set of reasons. That in utero, the blood that they receive is venous blood, so it's low oxygen. So they tend to have a lot of red blood cells when they're born, and then they have to Anyway, get rid of them.
I understand. Yeah, shed them.
Yes.
I understand.
So most babies have a little bit, and there's a quality of it that's somewhat protective. It's a very high antioxidant state. So in that early stage, not so bad. But what they do have a problem with is hemorrhaging. And so, and sometimes they used to give certain treatments, but certain treatments might make them have a greater propensity to hemorrhaging. So it's, you have this balance all the time. So yes, because early babies are more likely to be jaundiced because their liver isn't, is up to the job. So yeah. And now that's a whole thing, because now they're finding that going under the lights may be causative of other types of, a particular type of, I think, leukemia.
Oh, interesting. Wow.
So it's it's probably one of the most common treatments.
Yeah.
And they thought
My
it was
daughter- yeah.
fairly benign, and now they're feeling like maybe
Wow.
not so much. So
Hmm.
yeah, interesting. So once again, another opportunity for homeopathy too.
Good, good.
Right.
Thank you.
Great. Thank you so much, Catalina. 30 seconds left. Any other questions? No? All right. Well, why don't we congratulate and give some love to Catalina? Well done. That was
Very good.
Thank you. This is a tough crowd. I was like, oh gosh, there's all these presentations have been amazing, amazing. Tough
No,
in a great way.
You did amazing. You did amazing, Catalina. So thank you. Thank you.